Prevalence, why is it so important? Why is it worthwhile to have me come here today? If you look in the literature, constipation is it. It's the bomb. 3% of all medical referrals related to constipation. 5% of referrals to pediatric psychiatrists related to constipation, and 25% of all of the visits in our program have some relationship to constipation, either directly or indirectly. So we joke and we say that it pays the bills, pays the overhead, so that we can take care of some more complex patients. It is just really, really common. And children with constipation use much more medical services, $3,400 versus $1,100 per year. That's an old statistic. I bet you it's even more than that. Annual cost of $4 billion a year. I think that's a gross understatement when you consider the cost of constipation for kids and adults, and collateral damage in parents who miss work and all like that. It's just really, really common and really important for us to recognize. Quality of life scores. This is a relevant outcome measure. Everybody's interested in outcome measures. You know, what's the quality of life in these kids? Well, it turns out that patients with something as mundane or ostensibly as mundane as constipation actually suffer disproportionate decreases in their quality of life. This quality of life metric on the left, the higher the number, the better. So there are healthy controls. They live in pretty large, and their quality of life scores approximate 90%. There you see patients with IBD, the other area that I have an interest in, and you can see that those patients definitely take a hit with respect to quality of life. GERD, these are the patients who have recurrent substernal pain or dysphagia or whatnot, also bad. But here are our constipated patients, and look at their quality of life is half of that of our healthy controls, and even substantively less than patients who have Crohn's disease and ulcerative colitis. It is really in their face and really pervasive and impacts just about every aspect of their life. If you ask parents now, instead of kids, if you ask parents about their perceptions of their children's constipation and look at that over time, the longer that their children have constipation, the longer that it goes unaddressed, undiagnosed, untreated, the worse their quality of life. So it is not indolent, it is not static, it is progressive, it is dynamic, and probably makes a lot more sense to diagnose them very early on, or at least have our antennas up so that we can refer them appropriately rather than wait for long periods of time, because it does hit kids very, very hard. I include this slide with respect to the management of with respect to the elegance of the physiology behind constipation, and show you how much goes on. We, in some respects, trivialize it as avoiding function, but when you're on the inside and looking at the neuromuscular symphony going on, for lack of a better term, it really is impressive, and probably impressive that more patients don't have constipation. But there is an elegant coordination between the puborectalis muscle, which normally pulls on the rectum to keep it closed, and that has to relax. There has to be appropriate sensation by the internal and external anal sphincter, and then a coordinated Valsalva maneuver that helps expel stool appropriately and generate an appropriate line of force. You can imagine if you have an anteriorly placed anus and you're pushing down and the force is all being directed here, and the anus is right here, then patients are going to present with constipation. So at any step, from an organic standpoint especially, at any step of these of this symptom cascade, this functional cascade, you can manifest constipation. So there's lots that does go on, there's lots that can go on, and lots that can go wrong.